Folks, thanks for coming on the line with us today. My name is John Dubas with Premier Senior Marketing, and we'll be spending the next 45 minutes or so discussing some of the particulars about low-income subsidy and Medicare savings plans, different entitlement programs that help individuals on Medicare with the cost of their medications and medical services. One of the things that we want to start out with is a bit of information about us, about the program itself, and it will discuss the financial atmosphere that we have in the Medicare arena, deal with particulars on low-income subsidy and Medicare savings plans. We'll discuss the different levels of Medicare savings programs with particulars as to income and assets tests, and go through some standard questions that most individuals have about these programs. When you look at the financial challenges that Medicare recipients face, it's really hard to believe, but Social Security constitutes 90% or more of the income received by 35% of all Social Security benefits. This is a huge income for these individuals, and for many of them, that's all they have. So you have about 4.5 million eligible poverty level a few years back. Another 2.5 million or so that are classified as near poor with incomes below 125% of the federal poverty level. These numbers are significant when we go to speak to the different level systems that people go demonstrate and what they get for the qualifications that they have for the different programs. You also see that the supplemental poverty measure shows that the actual poverty level for older persons is actually considerably higher than what might show in their parameters. And this a lot of times is due to the medical out-of-pocket expenditures that factor into this sort of poverty calculation. When you look at the demographics of people that are 65 plus and the income that they have, now this doesn't constitute the entire Medicare population because we've got about 1/6 of the population on Medicare that are under the age of 65. But when you look at this, you can see how a good portion of the folks that are on Medicare are really strapped financially. If you look at it and go through the details, less than $15,000 worth of income, you're talking about 1/3 of the Medicare population. So this is a really huge piece of the population that we serve. And when you consider that the median income is slightly over $22,000, 44.5 million people that are reporting income, we realize that there are definite financial strains that are placed on individuals, and these are some programs that we can use to help them. As I mentioned before, if you factor in the medical cost, even a larger percentage of the folks fall under the poverty level. And if you look at a breaking off point at 150% of the federal poverty level, and that's an important number to note because it's the highest amount of income an individual can have and qualify for income purposes for these programs, and you consider about 1/3 of that income is eaten up by health care costs, you're looking at a good portion of our Medicare population with less than $1,000 worth of total income per month as an individual. Couples, less than $1,400 a month. Once again, this chart from the Kaiser Family Foundation gives us even a greater amount of appreciation for the fact that it is a huge market that is being addressed here, and it's a big portion of the population we serve as agents working the Medicare market. You'll see too that as people age, that need for assistance is even greater as we work through the savings that we've had as individuals as we age. There's an even greater need for assistance. When you look at the first portion of the benefits that we discuss, and we discuss low-income subsidy. These are Medicare drug benefits that are available to people who qualify based on income and assets, and you see that a good portion of them are folks that are already in a dual beneficiary status. So there's a chunk of people out there that have a little bit different mindset and a little bit different approach for us to take as insurance agents to address their challenges. You'll see too that many of these individuals are accessing the benefit on Part D through the majority of them 5 different carriers. They're dominating the market: United Healthcare, Humana, the CVS programs, Aetna, and Express Scripts. You're looking at 2/3 of the Medicare population being handled by 5 different carrier programs. The program itself, when Part D rolled out and the government started to publicize the assistance programs available for folks with the cost of those drug plans and the drugs themselves under the program, they did a pretty good job in publicizing the availability of these programs. But what you can see is it can be a process that can be helped by our explanation to the folks so they realize what exactly they have. And these assistance programs not only help with the cost of the premium of the plan itself, but for the cost sharing of the medications that are part of those programs. So generally we'll see a program that overrides whatever co-payments or co-insurance are part of the setup of the plan itself, and will standardize some of the drug co-payments for the different categories based on that person's income. It also gives them some relief for the coverage gap, the infamous donut hole, and will help with the cost of the plan premium itself up to the national average of the premium cost, which is right around $34 this year. You do have 2 different standards that a person has to qualify for in order to get this assistance, and one is an income test that goes up to 150% of federal poverty level, and that income test in 2017 for an individual is slightly over $1,500 a month, with a liquid assets test of $13,820. There is a bit of a here as well, because the income limit for couples is a little over $2,000 at $2,030 a month, and an assets test of $27,100. There is an online application available through the Social Security Administration website, and we as agents can help with that process should we choose to do so. I'm pausing for a moment because I'm going to pull something over here for us. If we go to the Social Security website, and we go to the Forms section, scroll down a wee bit, you'll have a section here that allows for an online application for extra help with Medicare prescription drug plan costs, and it takes you right into this system that helps with an explanation of those costs and the application process itself. So it's a way that an individual can access the application for this assistance off the internet. There are paper applications available. I strongly recommend that those not be used. They take longer to process, and with the handwriting of some of us that are involved in the process, and sometimes it makes it a little harder to process than it need be. What you see with these programs is a variance in the standards of the setup of the Part D programs themselves over time. And with the standard setup of a Part D program, if the plan doesn't do otherwise for that individual, they have to meet an annual deductible. And for 2017 on a standardized plan, that's $400 per year. They have an initial $3,700 monies to be spent for their medications until they reach the coverage gap, where they then have to go into and spend a certain amount of money before catastrophic coverage kicks in. And this is a limit of a true out-of-pocket cost of $4,950 this year. What it does for the individual, though, during the coverage gap is you have a partial subsidy, a discounting of the medications during the coverage gap that includes a 60% brand discount during the gap and a discount as well for the individuals on their generic medications. When we look at the costs then that come as part of those programs, if somebody qualifies for the assistance, they're not paying a deductible or any co-payments if they're institutionalized. Up to 100% of federal poverty level for non-institutionalized beneficiaries. These are some of the numbers that give us a strong indication of the fact that the person has LIS already in place. So if they are paying a standardized generic co-payment of $1.20 per month, you know that person is getting the assistance already. And what this does for us as an insurance agent is helps us realize that that person then has a continuous special election period that allows us to go through, review their coverages, and make changes should they benefit the beneficiary. Some additional information on the programs themselves is then, of course, if the individual is over 100% of federal poverty level, the co-payments are higher, $330 for generic, $8.25 for the name brand medications. So it gives us an indication then of where the person falls in the assistance that is part of the extra help programs. It gives us then through these charts some additional information that helps us also quantify what a person pays for drug co-payments if they are on a Medicare savings program as well through the QMP, SLMB, QI programs, which we'll discuss in a little bit as well. Pardon me. It also helps with determining the folks that once you get above 135% of federal poverty level, that's the maximum that a person can have coming into their household and receive assistance through a Medicare savings program. Between 135% and 150%, a person can still get help on the cost of their medications, and it then is a graduated scale, in a manner of speaking, of the assistance that the person gets for qualifying for that extra help. They have a small deductible that they have to pay of $82. It beats that $400 that they'd have to pay if they didn't have the assistance in place. And then, of course, there is a co-insurance that comes into play for folks between those two income constraints of 135% of federal poverty level and 150% of federal poverty level. So this gives us then the information that we need to help with people as we encounter individuals who may be having challenges paying for their medications. This is a key piece of information that we can use as part of our marketing programs when we become involved in retail programs such as the Walmart campaign, or retail programs available through other carriers such as United Healthcare, or a campaign you might start yourself for a small independent pharmacy. So these are numbers that we really need to have in order to properly advise the individuals with whom we're consulting. There are, as I mentioned, ways that you can help an individual qualify for the program. We already looked at the on-site or online LIS application through the Social Security Administration. You also have a way of helping people by referring them to the benefits checkup programs through the Social Security Administration, and then the state health insurance assistance programs, the SHIP programs that are available in each and every state. One of the things that might help you as well explain these programs is there are different brochures available from Social Security that goes through and helps lay out this information in black and white in a piece that you don't have to worry about whether or not it's compliant. It's provided by the Social Security Administration, so you can lay your hands on these particular documents and make them available should you choose to incorporate that piece into your marketing campaign in dealing with folks with low-income subsidy. If you were to look at the online application itself, that's how it appears. The paper application is on the right. I would strongly recommend that if you're active in the Medicare market, that you have a number of the paper applications available, because there may be circumstances you run into in an appointment outside of your office, or an area where there may not be internet available with your laptop or other electronic device that you're using to help a person. This allows you to collect the information you need to enter in an application on their behalf once you return to your office or to an area that has internet access. That way you have the information that you need to make that online application, and it's consistent of some very simple pieces. Obviously, the contact information with their name, address, and social security number. They'll ask for financial information that includes the income and assets, as we've discussed. And it'll ask about the number of people in the household, because this can affect eligibility as well. Once a person's application is complete, the Social Security Administration will send a notice of approval or denial to the applicant within 10 to 14 business days. Why that's important to us as an insurance agent? Well, there's a couple of different reasons. One, it gives us an indication of whether or not the person's actually going to get the help. So it gives us a way that we can more properly gauge what might be the most appropriate program for the individual. But it also allows us to time when that special election period kicks in. Keep in mind, you may run across the number of individuals that qualify for this assistance, do not have it in place. You help them qualify for it. Once they receive this letter, you know that you're then able to go out and help them change coverages if appropriate through that special election period that is available to them on a continuous basis because of the extra help low-income subsidy programs. This slide with active links will take you to some different pieces of marketing material available from the government that can help you in your understanding of the program and help the individuals with whom you're consulting feel comfortable about what you're doing for them. It'll include a guide to the LIS program, different tips for helping complete that program. It'll go through, once again, the resource and cost sharing limits that we saw in some of the previous slides, and access once again to that online application through the Social Security website. A person can go through this application process as well by calling Social Security at 1-800-772-1213 or through the toll-free number for folks that are hearing impaired as well. It's another way of accessing the application process to help take care of these individuals. Medicare savings programs are kind of an adjunct but a separate program. The LIS program is a federal program available with similar limits across the entire country. Medicare savings programs, well, these are programs that are designed to help pay for low-income individuals' Medicare Part B premium, which standard, if they've been on Social Security for a period of time, it's still about $109 a month, which is over $1,300 a year. And for folks that are more recently involved in Social Security and Medicare, obviously they don't have that held harmless provision that keeps their premium lower, and it's about $134 for their Part B premium then instead. These are programs that are available in every state in the union, and while they're federally funded, they're administered by each state's Medicaid agency. So some things can vary from state to state. It's important for us to note the differences here because these programs also, as we go through the different layers of assistance, are available to individuals that qualify, and it does once again create a continuous special election period as well. What that also does for us, depending upon the layer of assistance that they have available, will also help them qualify in certain circumstances for certain dual special needs plans, which is an entirely different benefit structure. There have been emerging of the qualification processes for these particular programs, but when you're dealing with the low income subsidy, as we noted in some of the previous slides, at 135% of federal poverty level, you're paying out a different financial obligation than you would for the limits above that where it's only LIS. So as we go through these programs, we'll note some differences in the qualifications that are necessary for an individual to meet in order to qualify for this extra help here. There is also now a program that has been put in place over the last few years that allows a continuous factoring in of the LIS application to be further screened for Medicare savings programs, and this is available to all the individuals who qualify for LIS unless they opt out of that process. It's a way for them to get the extra help, but it does take extra time. So these individuals can also get assistance in qualifying for these programs through their state programs, the SHIP programs as well. There are also caseworkers available in different Social Security offices that can help them with this and their LIS process too. We'll note as we go through some of these different levels that many people who qualify for these programs do not have the program in place. And there are a number of reasons why that comes about. I mentioned that the government's done a pretty good job in publicizing the assistance for medication costs. They haven't done as good of a job in dealing with the lack of basic knowledge that many people have about the Medicare savings programs. And that's the biggest barrier for enrollment in these programs. Many people just don't know they're available and that they may qualify for them. Additionally, if they know about the program, many of the application processes for these programs are fairly long. Sometimes the font size, dependent upon the state, is smaller than some of the folks can deal with, and so they'll look at it and say, hey, I can't handle it. Or if they're looking for help to get to one of the social workers at a Social Security or SHIP office, sometimes they have transportation challenges that prohibit them from getting to those locations easily to get some additional help. And then, of course, there is the misplaced social stigma that some recipients feel that if they go on these programs, they are on welfare, they're on the government dole, and we're dealing with a proud generation that doesn't want to deal with that in many circumstances. These programs, like LIS programs, do have two sets of qualifications a person has to satisfy in order to be eligible. They include an income in most states. The assets test is excluded in certain states. That includes Alabama, Arizona, Connecticut, Delaware, the District of Columbia, Mississippi, New York, Oregon, and Vermont. Additionally, income level will be higher in some states, and standardly they are higher in the states of Alaska and Hawaii. If we look at some of the examples of what is an asset, that includes savings accounts, stocks, bonds, mutual funds, different annuities that an individual might have in place. And then when we look at samples of what counts as income, well, that includes the wages of a working aged individual, a person who is already on Social Security but continues to work. It includes their Social Security benefit or railroad retirement monies, any monies they may be getting from a pension they qualified for, or different 401k or rental incomes. So different things come into play. Income. An interesting thing to note, if you deal with an individual who is actually going to admit to you that they bury cash in a jar in the backyard, that's going to count, believe it or not, as an asset. Some things that are excluded as income, well, it excludes the first month of the beneficiary's monthly income if they've continued to work, and the first $65 of monthly wages as well. Additionally, half of the monthly wages after $65 is deducted, is also excluded, and if the person is a food stamp program, those dollars, in a manner of speaking, are excluded from counting as income as well. A couple of other things that count as excluded assets: a house and a car, regardless of the value of that house or car. In many circumstances, you may run into an individual who may qualify for a program based on their income, but they've got too much stashed, so to speak, and they do not pass the assets test. One of the few ways that you can help that individual qualify for the program by shifting assets is if their house needs improvement, well, they can put some of the savings that they have in place into the house improvement and lawfully draw down on their assets. And the same thing about a car. They could trade off on a newer car or have repairs done to their current car, and that will legal way of drawing down on assets. Some things that are excluded as assets in addition to that house and car: household goods, wedding engagement rings, burial spaces, certain burial funds for the beneficiary and their spouse, up to $1,500 a piece, and then life insurance with cash values of less than $1,500. Of the different categories of assistance that we go through, the first category was created by an act of Congress in 1988, referred to as a qualified Medicare beneficiary status, sometimes referred to as a QMB recipient, or you'll hear some folks refer to them as a QMB. These are folks that have up to 100% of federal poverty level, and believe it or not, even though this program is in play for nearly 30 years now, the majority of people who qualify for it don't have it in place. Around 60% of these individuals who qualify for the program do not have it in play, and that's where our knowledge of these programs can really help these individuals. 100% of federal poverty level for an individual in 2017 is a little over $1,000. For a couple, it's slightly less than $1,400. The assets tests, you'll notice, are lower than they are for qualifications for the low-income subsidy, the extra help program for the medications. These are assets tests for the MSP program of QMB. What this allows the individual, or awards the individual, is a waiver of their Part B premium and does allow for some coverage of planned copayments and coinsurance. It is effective the first of the month following the determination of eligibility for the program. So if an individual puts in an application for QMB status, they're doing so, let's say, in May, and it doesn't get approved till sometime in July, which is conceivable, the policy would kick, or the program would kick in, that's for the 1st of August. As I mentioned, this does pay the Part B premium and some copayments and coinsurance for the programs. It is important to note that if a person qualifies for this assistance, the member doesn't have to deal with certain costs at a provider, but the QMB status does not cover premiums charged by the health plan. What you'll see in many circumstances in some of the dual SNP programs is a split in the coverages that cost, the premiums associated with the coverage costs, between medical and prescription benefits. So many times you'll see a dual special needs plan that has a premium that they don't pay because it is actually pointed at the prescription drug coverage, and that particular premium, up to the national average of around $34 this year, is actually covered by LIS. QMB itself doesn't pay that premium. It's covered through the low-income subsidy benefit. The second level of assistance was created by an act of Congress a couple of years after the Quimby's, and this is the Specified Low-Income Medicare Beneficiary Benefit, the SLMB, SLMB, and the vast majority of the people that are eligible for this program don't have it in place. Over 85% of the people that are eligible are not enrolled in the program, and this is available to people with income of up to 120% of the federal poverty level that passed the assets test. So 120% of federal poverty level in the year 2017 is a little over $1,200 a month for an individual, a little over $1,600 a month for a couple. The assets tests are the same as for the Quimby program, less than the LIS program, the same as the Quimby's, $7,390 for an individual, $11,090 for a couple. And what this program does is it waives the Part B premium for the individual. So in many circumstances, we can see kind of a logic as to why some of the folks that qualify for this program, there's a higher percentage of them than there is for a Quimby, because we'll have social workers in our community that are aware of the Quimby program, and it helps the individual get relief for certain medical costs. This program does not. It only covers the Part B premium waiver, and so many folks aren't as willing to go through the application process to get this in place. If you think about it though, and the max income for an individual at 120%, a little over $1,200 a month, and they meet that assets test, and they can get an additional $109 in their Social Security check, well, you're looking at about 8% increase in their income. It can make a big difference for these folks when they get to the end of the month and they have more month than they have check. A neat thing about this program is the effective day is up to 90 days prior to the first of the month in which the application was made. So in this particular circumstance, they're backdating the approval of this program, and the individual Social Security check the next month after they're approved not only sees a waiving of that $109 that they had been accustomed to paying for their Part B premium, it may also include a back credit of up to 3 months worth of premium, another $327 to help them with the back payment of those Part B premiums. So they can make a substantial difference in this individual's check, particularly the month after the application is approved. When we look at the next category of assistance under a Medicare Savings Program, we're looking at the Qualified Individual 1, a QI1 program. This is a program brought about by legislation considerably later than the first two under the Balanced Budget Act in '97. The program had been funded by a block grant each year by Congress. The macro legislation of a couple of years ago now puts this into the general fund, so it's funded as the other programs are as well. They don't have to worry about the passing of a block grant. This is available to individuals who have income up to 135% of federal poverty level, and that is for an individual slightly less than $1,400 a month, a little more than $1,800 a month for a couple. Same assets test as the prior two programs, lower than the LIS, same as the other two programs. And much as the SLMB program, it also waives the Part B premium for the folks who qualify for this help. It too has an effective date up to 90 days prior to the first of the month in which the application was made. So if you're dealing with an individual who is between 100% of federal poverty level, clear up to 135% of federal poverty level, you're able, through these different assistance programs, to help them get basically a huge increase in their monthly income by getting the Part B premium waived, and their Social Security checks go up correspondingly. So it's a great way for you to help the individuals with their overall monthly budget, but each of these programs that we mentioned also, once it's in place, then helps that individual qualify for a low income subsidy if they didn't have it in place, and it also gives them that special election period, that continuous special election period that allows you to review their health and drug coverages and make appropriate changes for that individual anytime through the year. So the whole piece of the attraction of our program when we speak to expanding your prospect pool through LIS and MSP, if you help these individuals who qualify for this assistance, if nothing else by making them aware of their eligibility and pointing them to the means that they can use to qualify outside of your assistance, you're expanding your prospect pool and you're able to help people on a year-round basis. We think back to the initial portion of today's presentation and the number of people that are at this income level or below. It's over a third of the Medicare population. You have taken a good chunk of folks that weren't aware of this assistance, thought they were locked into their coverages. You're able to help them financially and through your particular assistance in making other healthcare programs available to them. This is a sheet that is really helpful for you to have as part of your presentation. It gives you the different levels of assistance that are available and the income limits and the assets tests that come with these particular programs. You don't have to have them memorized. It's kind of neat as you talk about them continuously. The numbers do get into your head and you're able to reference them without the sheet. But regardless of who you're visiting with, because you can't always judge the book by the cover, mentioning the fact that there are different assistance programs available for prescription or in some circumstances medical costs, you can make a huge difference as to whether or not that person is eligible for a change during lock-in. But what you're also doing is creating a much more loyal customer and one that is much more likely to render referrals as well. So it gives you a way of growing your business just by expanding your prospect pool here, but you're also opening up a number of possibilities of referrals as well. So this sheet can be very helpful to you when it comes to having the information available as well. There are different ways that you can, as I mentioned, also help a person qualify for a Medicare savings program. We went through how you can help a person by directing them to different governmental agencies or online for the LIS program. You have similar types of assistance programs available here where you can direct the person to a Social Security office with the social worker that it may be available there to help them with these programs. There are certain carriers that make this assistance available as well. The My Advocate program through United Healthcare, having information available through many of the carriers that offer dual special needs plans. They may have similar programs available to you as well, or you can be proactive and assist in the process yourself by going through and making certain that the application is completed for the individual and then helping that individual get the complete form to the nearest processing office. Keep in mind that the application itself, as it is submitted, there aren't requirements for supporting documentation to be submitted with the application. However, should the application during the course of processing questions arise through that processing process, that person needs to be aware of the fact that they may have to supply additional information through the application process, even if it's not necessary during the initial process. There is, as I mentioned, certain things that you can do to help an individual with an excess of assets, kind of a misnomer here because many times a couple, $2,000, $3,000, while they may not be a lot of money to some of us, they can be a lot of money for that individual, and if they look to transfer them to another individual, there is a 5-year look-back period that the government will go and ask to recover those transferred assets. So donating money to the church or to a family member or shifting it to another account in that fashion may not solve the challenge of having too many assets. So there are, as I mentioned, some things that you can do with working with the house, making certain that the car comes into play as well. And there are different irrevocable trusts that come as part of a process of planning, and you see them a lot of times through different final expense programs that can come into play that are valid ways of shifting assets as well. But generally the exceptions are limited, and a person cannot just donate money and reach the under the assets test. If a person does complete a paper application and drop it off, it is important to kind of document part of the process, make certain that they know who they can follow up with in order to make certain that the application is being processed properly. And keep in mind, where the LIS process is 10 to 14 business days, this can go 30, 60, sometimes 90 days in order for the application to be processed properly, depending upon, obviously, how well it was completed initially. It is important to note that as part of that application process, they use true dollar amounts, not rounded off, and that lends additional validity to the application. And it is an annual qualification process for these programs. So you'll see some folks get a little antsy at the beginning of the year because if there was a Social Security that kicked in, hasn't been for the last few years, or if they receive additional funds for one reason or another that count as income, it may knock them off a qualification because they do have to qualify each and every year. In order for you to become involved, there are different things that we've already discussed that enable you to become an advocate for your people for these particular programs. When we look at the Medicare population and the fact that the median income is right around $24,000 a year, you got a ton of people that can be affected by these programs. Knowing some of the basics can make a huge difference on tying individuals to you more carefully by making certain that you're maximizing their benefits, and it does once again allow you to grow your prospect pool through your involvement in these programs. So it's very important to be aware of the changes that come about with them and to keep it as part of your overall marketing program. Remember the slide that laid out the different levels? Make certain that you have that as part of your presentation information. Commit to knowing some of this information now and look to move forward with the programs on an ongoing basis. You have a number of individuals here in our organization that can help you with these programs. Today's presentation is being recorded and will be sent to all that have expressed interest in today's presentation. So you will be getting a copy of this presentation. You'll note that many of the programs here, the income levels are not part of the expansion of Medicaid benefits brought about by the Affordable Care Act. So much of the changes that come into play with Trump Care, if you want to call it that, whatever future legislation comes into play, it won't immediately affect these programs. Some cases not at all. And some of the things that you see is there may be a graduated rollback on some of those programs anyway. So keep in mind, year to year anyway, this is the program we have with 2017. 2018, we re-examine the programs and the numbers that are available, and we deal with that as it comes. It's one of those, we cross the bridge when we get there. So keep in mind, once again, that as a participant in today's program, You will be receiving the information, and your marketer will be following up with any questions that you may have about these programs as well. So that said, I want to thank you for coming on the line and joining us today to learn more about these assistance programs available to people on Medicare. We appreciate your interest and the time that you've invested with us. Watch for that follow-up. We look to speak with you in the near future, and in the meantime, we wish you good selling.